Okay, so let's continue.
Okay.
All right. Okay, so cervical wounds usually have they achieve just about 70% of their tensile strength, of their wound strength. They don't completely gain 100%.
Madam, your
So,
keypad is worrying you.
with my so usually when somebody is giving me feedback. Okay, so usually when the sutures are removed at like 1 week, the wound just has about 10% of its strength, and this increases with time. And so don't expect that the wound will go back to, or the tissue will go back to the way it was before the injury occurred. And the wound strength reaches about 70 to 80% of its tensile strength, but it doesn't completely regain everything. And so it's important for you to bear this in mind when you are advising patients. Maybe a patient has had, let's say, a cesarean session, and within 1 week they've been discharged. When they go home, you should advise them not to do any strenuous activity like picking up heavy loads or carrying buckets and so on and so forth, because those things would exert mechanical stress on the wound. And because the wound has just about 10% of its tensile strength, after 1 week, you can easily have the wound gaping. Now, there are some factors that affect the repair of the wound, and these have been listed on the slide. So infection is number one. If you have an infection, a wound that has been infected, it means that the wound will not heal because the inflammatory process will be ongoing and it will interfere with the repair process. So infection is a number one no-no. So usually when you're dressing a wound, we advise that you press the edges of the wound to see if there's any pus coming out. Because once you see that there's pus, it means that that wound is infected and the healing will be problematic. And so that patient will have to be given antibiotics to augment the infection clearing and help with the wound healing. Nutrition is also very key. We talked about collagen being deposited in the wound to strengthen the wound. And so you need to eat very well. Good protein diet will help with wound healing. Vitamin C is also another thing that helps with wound healing. And then zinc. I didn't add the zinc, but zinc is also very important. So usually, patients who have bad wounds, you put them on vitamin C and then a zinc supplement and advise them to eat well. And usually, it helps with a quick recovery of the wound. Now, sometimes too, inflammatory. Remember, I was saying that when there's an infection, it hinders the wound healing because the inflammatory process prolongs. It drags on for a long time. And so when you give glucocorticoids, they are anti-inflammatory, so they decrease the inflammation and help with the wound healing. Then mechanical factors like increased pressure or torsion on the wound. It's similar to if you have a wound, you keep scratching the surface of the wound. Or if you have a cesarean section wound and you keep lifting heavy loads, or coughing or straining, which increases pressure on the wound. These can disrupt the wound and would hamper the repair of the wound.
Hello.
And blood supply. If you have a situation where the blood supply to the wound is decreased, the blood is supposed to bring nutrients. It's supposed to bring oxygen protein to the area. So when the blood supply is limited, you can have impaired wound healing. And then presence of foreign bodies. If you remember when we were talking about inflammation, I said that if you have, let's say, a suture in a wound, which is supposed to be removed, if the suture is not removed, the body senses the suture as a foreign body, and the inflammatory process will be ongoing. And so once the inflammatory process is ongoing, the wound will not heal. The same scenario occurs when, let's say, you have a wound such that maybe somebody hit somebody on the head with a broken bottle, and then some of the pieces of glass entered the wound. Now, when you are suturing such a wound, you have to do what we call debridement. You have to wash out the wound very well, clean it. Sometimes you use a jet of water to clean it and make sure that all the small pieces of glass or foreign body are removed. Otherwise, the foreign body would serve as a means of continuing the inflammatory process. And so the inflammatory process will become chronic, and that will prevent the wound from healing very well. Okay, now there are some pathologic aspects of wound repair. For example, extensive scarring occurring. As an example, in a patient with a myocardial infarction. So such a patient, you know, the heart, the myocardium is made up of permanent cells. And these permanent cells, they do not regenerate. And so because they don't regenerate, when there's an injury, the healing is by scar tissue formation. Another example is keloid formation. And for keloids are exuberant amount of collagen being deposited. So the whole repair process is regulated by checks and balances. You have the wound formed, granulation tissue deposited, then collagen is deposited to strengthen the wound, and then you have scar formation. If you have a situation whereby the collagen deposition is excessive, then you have keloid formed. Now, these keloids are an inheritable condition. Those who have it, those who don't. It's very common in blacks, and usually you have a small scar or a small injury, and there's excessive deposition of scar tissue, and then you have the keloid forming at the site. Then another pathologic aspect of wound repair is hypertrophic scarring. So the hypertrophic scarring too, there's excessive formation of granulation tissue, and this protrudes above the level of the surrounding tissue, but it isn't as extensive as keloids. So this is called exuberant granulation, and usually for hypertrophic scarring, you can remove it by doing cauterization, and it will not recur. But for keloids, if you cut it, they'll come back because it's a genetic predisposition that the patient has. So thanks for your attention. If you have any questions, let's hear them and then try and answer. Yeah.
Okay, you can unmute your microphone now and raise your hand.
If you have a question, go ahead, please.
Costa.
Yes, sir.
All right, your question, please.
Madam.
Yes.
Yes, madam. Madam, I want to know why the deep wounds leave scar. The deep wounds. Why do they leave scar? Is it because of how deep they are?
So at the very beginning of the lecture, I was saying that when you have a wound which causes injury to the basement membrane of the particular tissue, then there will be scar formation. The reason is that the basement membrane is what helps to regenerate the tissue. So once you destroy the basement membrane, there can be no regeneration. You can only have scar formation. So if it is deep, it means that the basement membrane has been destroyed.
Was affected. Oh, okay.
Yes.
Yeah. And another one is the keloid.
Yes.
Is it all?
I can't hear your question.
Hello, ma'am.
Yes.
Yes, I wanted to ask of the keloid.
Mm-hmm.
Yeah, you said if it is genetic,
Yes.
then even a small scar will give you the keloid.
Yes.
So why is it that there's no medication for that type of disease?
Because it's genetic.
So
Yeah, genetic diseases are a bit difficult to treat because it is from the DNA of the patient. You see?
okay, but some people too have been using this anti-keloid also.
Keloid injections.
Yes.
There are keloid injections that a lot of clinicians use, usually the plastic surgeons.
Yes.
It has to be done very well by somebody who's experienced, because when you give the injection, the small tissue injury that is caused can even further exacerbate it. So it has to be well done.
But it will come again, right?
Yes, usually.
Yes,
Yeah.
because I've seen someone who have been given the anti-keloid injection, but when it went down, it's for some time it came back.
It usually comes back. So most people
so there's
don't.
no need for.
Most people don't. Just let
Okay.
And then
Madam, can't they do surgery to take it off or something?
So the thing is that when you have an injury, I think after you ask your question.
Evans, mute your microphone. You're giving us feedback.
Good. Thank you. Okay, so usually what happens is that when you have trauma to the tissues, if there's an injury, the healing process would lead to deposition of collagen. Now, in patients who are predisposed to keloids, they have an exaggerated deposition of collagen. So let me give another example. It's like you have asthma. When you are asthmatic, everybody will inhale a strong perfume and maybe sneeze 1 or 2 times and be fine. But when you are asthmatic, your reaction to the perfume is exaggerated. So then you start sneezing, your sneezing gets out of control, and then you have difficulty breathing. So it's similar to the keloid, people who are predisposed to keloids. When you have a wound, an injury to your skin, the healing process requires deposition of collagen for the healing to occur. Now, your deposition of collagen is excessive. And so it's like you take everything World Cup and you massively accumulate collagen to the extent that you have that growth point. Every time you have an injury to the tissue. Okay. Whose microphone is that? Any other questions?
Not. Not your microphone. Okay, thank you.
Any other questions?
Could be a question that I be said.
Oh dear.
Elisha, you have a question?
Is a question.
Yeah.
Executioner.
Okay, so can we end it?
Yes, madam.
Yes, ma'am.
Yes, ma'am.
Read.
Yes, madam. Executioner.
Executioner,
Thank you very much.
Have a good night, madam.
Thank you very much, madam.
Bye bye.
Thank you.
Kelly, I didn't get
Enjoy yourself.
Madam is there.
Enjoy yourself, madam.
Yes.
Enjoy yourself, madam.
Why are you telling
Later, madam. How are